let me
Okay, so what were the common health challenges that are faced by elderly patients, and how do you address them in your practices?
Okay. So the most common problem for elderly, so these are where we're speaking anyone above 65, and so they have the problem that I encounter is that hearing ability. So that creates a challenge in itself. So you have to adapt to some of these patients can afford hearing aids, some of them cannot. So being able to speak clearly and enough at close enough, and they so loudly sometimes too, so they can understand. The other issue, the common that I kind of made a list. Other issue is like a mobility and frequent falls. That becomes very common in these patients as they age because of the weak generalized sometimes muscle weakness that happens, and that not only that but just the cognition as well that predispose them to have a frequent falls. The other thing that we see is the ability to do what we call EDL, which is activity of daily living. So just doing your routine, like, in-house, bathing, grooming, being able to feed yourself, going to the groceries and paying your bills. So those kind of other challenges outside of just having the medical, so-called hypertension and that. So those are the common things that we focus on. The other thing is polypharmacy, because as they age, they have a lot of chronic medical conditions, which requires a lot of medication. Sometimes they see multiple specialists, which sometimes can lead to duplicate and too many medications. So we call that polypharmacy. The other thing, as I was mentioning earlier, was dementia, like cognition decline. So dementia is the other thing that we encounter most commonly in these patients. So how, and you mentioned you wanted, how do we address these challenges? Is that what was your second part?
Yeah.
Okay. So the one part I mentioned with the hearing, we have a routine like preventions that we do once a year that require us to do a hearing test. So that is how we try to prevent. We provide patient resources of local community of where they can get hearing aid. Sometimes over the counter, just Walmart, and that, so that helps. In terms of dementia and cognition, same thing. We do screening. For some patients, it's a once a year. Some patient more frequently, depending on their family or even their partner, that they'll have concerns, and so we address it. That activity of daily living, if they're not able to, like as I earlier mentioned, grooming, bathing, and that some community have resources where they can provide an aid, and it's state specific, and that person would come and help them with a grooming and sometimes even groceries, and that sometimes family members needs to step in to help out with that. And then in terms of falls, same thing. We have falls prevention screening. So we talk about physical therapy. We talk about preventions that you can do at home, avoid loose drugs in that. And with polypharmacy, I think most of the provider, but we try our best, at least I do. With every visit, I go over their medications and to make sure what exactly they're taking for and who is prescribing, so patient has an idea as well. And then that way we avoid polypharmacy if we can.
Yeah, I think it's nice how you mentioned that, like, you conduct those screenings once a year for patients, and then you're also providing them with all these resources regarding
Mhm.
any of the issues they may have, like especially you mentioned with hearing, because I feel like a lot of times, they may not know much about the conditions they may have, so it's nice how you walk them through all the processes.
Right.
So in managing all these conditions, how do you prioritize and coordinate the care of elderly individuals?
Yeah, so I think it depends on that visit itself, and some visit we can prioritize on the medication that's go over there, and some visit I prioritize more on their social needs, like the other aspect we were talking, especially in West Virginia, we don't have a lot of resources for elderly. So we focus on the way, if we can get the family member involved, someone to help. So my priority first is patient safety. Are you safe enough to be able to drive home? You have enough food at home, and then in general, the other thing is mental health. So those are the kind of stays at the priority, and then we focus on obviously whatever complaint you have at that day. But that's kind of like my little routine for my these elderly patients. Just I always ask, how is it at home? Any falls? Any memory changes? Because even though you're seeing them every 3 months or that, but so much can change. So that's how I prioritize their challenges or health needs. It depends on what the visit is about and how urgent the issue is.
Yeah, I think it's really important how you mentioned mental health, especially as far as a priority for patients,
Mm-hmm.
because I feel like that really shapes someone's like well-being and just how they think of themselves, and that can also cause long-term issues if mental health can if it's an issue amongst patients that can lead to long-term issues. So as far as like promoting physical and mental well-being, like how do you like share these insights to your patients?
Yeah, so what as you were saying with mental health, because in this elderly patients, sometimes some of them don't have family support, some of them have lost their spouse, some of them don't have family in the state they're living in. um, so I try to provide them with the community resources, because majority of the community will have like senior centers, which are a great way for these people to get out and communicate with their friends, colleagues, just their age, because they feel like some of them they'll lose their friends who passed away sooner than them. So then they'll have sort of that depression set in because they lose their community support. So it's good to, I try to encourage that to patients about community resource, church group, having regular phone calls with your family members who are out of the state. At least some of them are capable of doing this Zoom, FaceTime, and that. Some of them are not, but even just a phone call, because the loneliness does set in and it is difficult. And the other things that we focus on is having daily routines. So whatever routine, like you get up and I have breakfast and I walk my dog, or I go pick up my mail. Having routine helps the brain and helps the body as well. So we focus on that, and we focus on more also on the physical activity, and it could be just brisk walking for 15 minutes. It could be also going to YMCA, going to the gym. They have a lot of classes for their age group, sneaker classes and that. So doing that, having physical health also helps with the mental health. So we focus on those areas for patient, basically providing and promoting resources.
Yeah, I think that's everything that you mentioned, especially like the first part about, the social aspect, making sure that they have people to talk to at home. And, if they don't have a family, I feel like senior centers especially are a great place for patients to be. Like I volunteer at one and I see that like it's
Yeah.
just like how happy they are when they're, socializing together with everyone when they
Right.
have activities to do. So
Right.
as far as like you individually at work, like and how do you work with your coworkers and your team in general? Like, do you guys all have the same role? Do you guys all play the same role in patient care, or does everyone have like a individual role in that sense?
Yeah, so I think because this is a little bit different, the setting that I am in. So I would say me and my staff. have a similar role versus another provider because that provider is not involved in my patient care directly. So we don't have, but all of us have similar sort of understanding and ideas, and how we want our these patient populations to have a better, I guess, outcome from the life. So we all have kind of collaborate on that aspect, that hey, if someone knows about new resources or something going in the community that I'm not aware, we share with each other, and then we pass it on to the patient, because everyone has a different, if you come from different background, and that you'll go to different churches or different religion, then you'll have different things that and you will encounter all sort of patients. So in that regard, it helps collaborating with other providers to give patient resources in the community.
Yeah, and like you said, I feel like it's always nice to work with a team because, whenever there's any issue, I feel like everyone can share their own and their different insights about something, which can,
Right. Yeah, and
yeah.
it's important in geriatrics and in family care in general, because we have this relationship with these patients. So my MA and my other staff, they know these patients because they see them each time, and so they can also pick up if there is any concern when they're rooming them or something they're being said. So it's a good environment in that sense, because we have a continuity of care with these patients, so we can kind of see how things are out of picture, if something is going on, because they were not like that the last time.
Yeah, and adding on to that, like, how do you stay updated on, the latest research and advancements in geriatric medicine to ensure that you're providing the best care for your patients?
Right. And I think there are probably a lot of resources. I in general, I read up a lot on up to date for screenings and prevention, and then I am a member of AAF, American Academy of Family Physician. They also come out with every month. We have these journals which talks about like preventions and in geriatric care dementia, and then there has been some new studies going on and medications coming on dementia. And then I do like to listen CDC for any vaccination updates, and that we do that. And then I'll also listen to NPR. And then there's something called People Pharmacy. I don't know if you guys have it in your state or not, but that's something I also kind of like to get, not for just geriatric, but just to update myself and see if there are some resources through that for patients, and the alternative medication pathway.
Yeah, so it seems like you're very involved, like in every aspect of your field, not only with knowing, how to provide patient care, but you're also a part of many like outside organizations, like you mentioned, the American Academy of Family Physicians. So what do you feel is like the most rewarding aspect of your job?
Uh, the I will say the most rewarding aspect of my job is that the over the years, the relationship you build with this patient. You in medical field, any doctor, we all deal with people. This is not a thing. This is a live person, and that relationship over the time you have with patients, and seeing how well your patient progress from example diabetic being uncontrolled to control, that is rewarding to me, that I feel like I have guided this patient and this person to better their life. So that is very rewarding to me.
Yeah, I agree. I feel like that's something very important. My mom also works in healthcare, and I feel like it's just whenever she comes back from work and she's helped a patient or she's seen, a lot of improvement in their condition, it's just very inspiring and it's very happy to know that, you've made a positive impact on someone's life. But
Exactly.
then with that being said, I feel like there's also many challenges that come with working in healthcare. So what do you feel is like the most, I guess, hardest or challenging aspect of your job?
The most challenging part of my job, I will say, is dealing with a lot of paperwork, especially in being in family practice. We have lots of home health orders, prior authorization of the medications, and I will say the insurance, because insurance determines which medication sometimes patient can have, even though you want that patient to have another medication. So especially in Medicare population, elderly, we run into that a lot. And I sometimes I feel so sad because I'm like, I know you could benefit from this medication. So then we look for outside of that to help. Luckily, we have some resources, but not a whole lot. So yeah, dealing with insurance and paperwork, I will say that is the one thing I don't like.
Yeah, that does sound pretty tedious. I'm sure that, no one really enjoys doing that.
Right. No, I'm sure if any of the other physicians are listening, they'll understand. Prior authorizations
Yeah.
are pain. Yeah.
And like for patients that you're treating that, have a very critical condition or, they may not likely have 100% recovery, like how do you address, end of life discussions or advanced care planning with these patients?
Yes, so good. I'm glad you brought that. As we were talking about earlier, preventive approach. So every EMR, basically what we call electronic medical records, they have system built in for preventive measures. So Medicare, which for these people we're talking about geriatric, anyone above 65, have once a year visit called Medicare Annual Wellness. Okay, basically at that visit we talk about preventions like the hearing, visions. We talk about things at home, activities of daily living. What are the things they're able to do? Home safety, gait mobility, fall preventions, and the other one on that is immunizations, preventive measures for colon cancer, prostate cancers, for breast cancer, things, and then advanced medical directive is part of that. So we try to have, during that visit, we try to have that discussion whether if patient has it. If not, then I talk to them about what it means, and we can help them fill that out, because it's important to have that when patient is in fully their state of mind, so they're able to make the decision. So we know what their wishes are. If something happens, then that's the time that we can make a decision that they would like to have. So during the scenario you were mentioning, I every hospitalizations they go to, they ask every patient whether you want it to be resuscitated or not. It's like a standard protocol thing, all the physicians, and they ask. So that's already there. But even more important for us is, like I said, we address it on that once a year wellness visit. If I see that patient is declining, I document, write down whether they have a medical power of attorney or someone who they trust, if something happens, that they would be able to make that decision for them.
Yeah, it's just nice to know, all the programs and all the incentives that you offer to just address and, pinpoint the conditions that your patients may have. And I feel like, just all of this really helped me better understand your field. And I'm just really happy to know more about it. And it's made me even more passionate, about pursuing a career in healthcare, in the
Oh, great.
future.
Yeah, yeah,
Yeah.
yes, yeah. It is, I think no matter which aspect of medical field you go to, it's very rewarding. It's just you gotta decide which field you want to go to. But
Yeah.
geriatric is very special. I'm sure a lot of you could relate, because by stats says by 2050 there's going to be triple the age of 85-year-old, and so we're definitely going to be seeing a lot more people, because people are living longer life. So yes, it's
Yeah.
important to be aware of all this.
Yeah. I just wanted to thank you again for just, sharing your insight with us and
Sure, no
for
problem.
coming here and joining us.
Yeah, you're very welcome. I hope it helps. All right.
Yeah, it surely does. Thank you so much
Oh,
again.
you're very welcome. Do you guys have any other questions?
I think that was pretty much it. Devna or Emma, do you guys have anything you wanted to ask?
No, I just wanted to thank you for joining our interview today, and it was very informative to hear your perspective on various things.
Okay, thank you guys. Good luck to you guys. Yeah,
Thank you so much.
Thank
yeah,
you.
you're
Good luck to you.
welcome. Yeah. Bye.
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 Bye, thank you.